night, everyone. Thanks for coming to week 2 here, December the 20th, for some more respiratory education. Today we're going to talk about chest tubes. We all have done them at some point, I'm sure, but we don't do them every day. So first things first, you need to get your supplies. So if doctor has said, yeah, we're going to put a chest tube in. For Terrace Bay, our kits look like this. Chest tube kit. It lives in the trauma room under our sink. Marathon, please, if you're watching, check out where it lives in your trauma room, in your emerge. This is ours, so we should have the same things. If we don't, let me know, or Jordan or Bonnie know, and we can go from there. So inside your kit, we'll just do a quick review. We will have your checklist of items that are in it. Alright, insertion kit, that is there. And new that I have added is a nursing care guideline called STOPS. So every shift we are to be checking the site, the tube, the output, the patency, and if the site and seal is, or suction and seal is adequate. It does say on here everything you need to look for. If you have a patient admitted to hospital, please feel free to pull this out and put it at the patient's bedside to remind you what to check and keep an eye on. Something else that I have that is new in Terrace Bay Marathon, hopefully you guys can add it, or maybe you have something similar, is an emergency bedside kit. Please, again, if you have a patient who's admitted to hospital, let's put this at their bedside as soon as they're there. So in it we have sterile water. You're going to use this if the tube is disconnected in any way. You put the broken part of the tube, the end of the tube, into the sterile water to create its own seal. If the tube is completely pulled out, we all have those patients, you need to put a dressing on the site as soon as you can. So Vaseline gauze is actually the procedure. We don't carry it here, at least in Terrace Bay, so we have chosen to use Adaptic and then cover it with your gauze and then tape on 3 sides, only 3, so that the air can escape. You can use Hypafix, you can use whatever tape, just tape it on there, and obviously in both situations you're going to notify a doctor. Just a heads up, inside this emergency kit I do have the checklist of what should be in it and the emergency issues. So take a look if you do have a patient, just some good reminders. And again, place that at the patient's bedside. So we're going to do a chest tube. We got our kit out. Doctor is coming. We get a chest tube tray ready for doc. I'm not going to open that because it is all sterile for them and we don't really need to deal with that. You also need to get your sterile chest tube drainage system. Again, this is sterile, so you wouldn't be opening this until you were ready and that you were sterile as the nurse. It does come all wrapped up in blue and inside a bag. In order to open it, it's just a tape seal at the top. So that comes out. You would unwrap it. Again, you have your sterile gloves on at this point, and you're ready to go. Just gonna leave that here. So you've pulled it out, and then just to prep this, while your doc is doing whatever they're doing, freezing and whatnot, you can prepare this even before, as long as you are sterile. So it comes with 20 mils of sterile water. This needs to be injected into the top of your chest tube drainage system, and it's going to fill this bottom piece to create that seal and suction. So again, there's 3 valves, so 1, 2, 3. It is this middle one that this goes in. Put it all in, and now it's ready to go. Our chest tube systems have a fan that just spins. There's a press on top to make it go in. If you choose not to use that, it can also hang on the bedside with the side straps. So we're all set. Doctor's all set. He or she is going to ask for local procedure. So they've done all their sterile prep. Then I want to freeze the site. We have a procedure bag that's ready to go. The only thing you need to ask for is what kind of lidocaine they want. want. So 1%, 2%, and then with or without epi. Okay, so they're now frozen. They're also been prepared, so you have chlorhexidine swabs and a razor if needed. Okay, so now the doc's ready for their chest tube. You can open this for them. They will take it out. They will insert, hopefully easily, into patient. So this is now inside your patient. Go this way. Okay, one little note about these new blue-tipped or blue-ended chest tubes is they need to be cut. So I have already cut mine on an angle. They come completely pointed and sealed, so you need to cut it on an angle, or else it's not going to connect to your drainage system. Another tip, and what we have learned, is that you also need a connector. So a chest tube drainage connector looks like a double-sided Christmas tree. This is going to go into the blue tip and into your chest tube system. To create a really nice seal, you're going to grab your elastoplast and tape around that connector. Otherwise, you're most likely going to get alarms and it's not going to be suctioning, it's just going to be awful. Okay, so chest tube is in patient, chest tube drainage system is hooked up to patient. Tape is on. Now you need to ask doctor or RCCR if they happen to be on call, what kind of settings? Are we putting it at straight drainage? And what kind of dry suction do they want? It's automatically set to 20, which I find they just leave it at that. And then it would just drain. Make sure you have it lower than the bed, either hanging on the side of the bed, the stretcher, or sitting on the floor. And it would drain. If they want it to suction, you're going to open up your suction. And there is a piece on the top. You can actually see it pointing up here. This is your suction connector. So that goes to drainage container, and this goes to your wall. This is hooked up. You will need to clarify if they want it continuous suction or intermittent. If they do want intermittent in Terrace Bay, you need to go get the lovely Gomco suction. In Marathon, please clarify what you use for intermittent suction. We don't have it on the wall. We have to grab the Gomco. All right, so they're all going. Last thing that you'll want to make sure is what has the doctor put on a dressing. We do have a dressing bag. Again, there's tape, gauze, and adaptic or Vaseline gauze if that arrives at any time. That is pretty much it. Again, as you go, if you do have an inpatient that stays with us, make sure you put the bedside emergency kit beside their bed and that you're checking it every shift for those things. And when you do check, you want to check, when you check your output, you need to make sure it's being marked. So either with a pen or with a marker. I'm trying to get closer here. You need to mark on how much output has come. So at 7 o'clock this morning, there was 30 mils. Then the next shift, you're gonna write, okay, there was 60. And that's to keep track. A, you have to chart it, but B, if there's a sudden increase in output, doctor does need to be aware and changes might need to happen. I think that's it. Have a wonderful day and I will see you next time.